Good afternoon, and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television, and glad you're able to join us for this episode of Ask the Doctors. Our doctor is Dr. Thomas Huth, who is Vice President of Medical Affairs for Reed Health. And normally I turn over here and I really get some smart aleck thing coming at me with some animal or something. Normally it's Dr. David Jetmore, Wayne County Health Officer, but today it is Christine Stinson, who is Executive Director of the Wayne County Health Department. I appreciate you joining us today.
Yes, thank you.
Christine is not a doctor, but she's playing one on TV today.
Yeah, I'll try not to overstep my bounds, but I happily step in for Dr. Jetmore today, who couldn't be here.
I think a lot of people actually will probably be happy that you're here and want to hear from you. Not that they don't want to hear from Dr. Huth, as they always do, but because some of your recommendations, some of your thoughts have gone into the conversation this week since the governor last week, about a half hour from now, made his five-stage plan known as to what was going to happen. The health department has kind of been the place where our political leaders have made their decisions. Talk a little bit about how that conversation went. I know you all didn't deviate greatly from what the governor laid out, but talk about what Wayne County has planned.
Sure. Yeah, we sat down, the commissioners and Mayor Snow, and looked at the governor's plan and what that meant for Wayne County. It saw that there were some things that were in there that we were uncomfortable with. One of those was opening public pools, and so we recommended that those, maybe we save those off a little bit. We agree that it is time to start creaking the door open, putting our toes in the water and testing some things out. But we really felt like opening movie theaters where people would be sitting in relatively close contact with each other for extended periods of times, that should be pushed back, and swimming pools. It's hard to keep that social distance when you're in a swimming pool. It should be pushed back and see where we're at come June 14th. And then hopefully our numbers will be relatively stable and maybe trending downward. And we'll be able to open the rest of the things up a little bit more come June 14th.
Dr. Huth, as you all had read, had a chance to digest some of what the governor laid out, what were some of the things that you all were looking for? Did this fall as you thought it would? Were there any concerns? Were there any things that you all were pleased about? You obviously have to look at the fact that as people go out, there's a good chance you'll see more cases. Do you have the type of PPE that you want to have? Is all of the things in the hospital separated? You've talked about the fact that you've created almost a couple of different ways for people to come in, those who have a respiratory illness, those who have other things. Talk a little bit about where the hospital is at this point.
Well, I think when at Reed, when we consider the governor's plan, the five-stage plan, there are a couple things that we consider. One is, what is the impact on the actual provision of healthcare services in terms of what we can do and can't do? I mean, since the beginning, we have delayed some of the more routine surgeries and doctor's visits and that kind of thing. But we've already got a plan to ramp those up over time, and we want to make sure that our plan is consistent with what the governor has laid out for the resumption of healthcare services other than emergency services. And so we feel confident that we've got a good plan to do that, and entirely consistent with what the state is expecting of us. And so we've analyzed it extensively from that standpoint. Then on the other side, we've got what is the impact on the healthcare system from the things that you mentioned, people coming out of their homes and getting involved back in community activities, whether it's work or other activities, retail activities, and so forth. And we make the assumption that that's going to result in some level of increase in COVID cases in the community. Whether that will happen or not, we'll all find out together. But we just have to think ahead to, what are the implications of that if we do have an increase? Do we have the number of beds, the physical space to take care of the COVID patients? Do we have the PPE and the staff? And we're very comfortable with where we're at currently and where this could go in the foreseeable future. So I would say we don't have any problem at all with what the governor has laid out. We think it's very rational and reasonable and very well paced. And seems like a solid plan that if something's not going well, if there's a too high of a spike in cases, and particularly if that begins to cause too much pressure on healthcare resources, whether that's here, but particularly in the hotspot counties in the state, and that's particularly Marion County and the surrounding ones, have always been more drastically affected. And then also a couple of other counties, Lake County, Cass County, and some others. I think the state leaders are going to be looking at the implications for resources in those areas, and we'll be making adjustments to the overall plan on that basis. But with a little bit of luck, everything will go well. And if we do see some increase in cases, it will all be manageable within the resource constraints that the major systems have, including Reed. We're comfortable with where we sit, and staff are now well prepared. And I like to say that the last 5 or 6 weeks have really been kind of a trial run for us to, how quickly can we pivot into action and be ready for the cases, and how are we going to manage them in the intensive care units when they're on ventilators and have special needs for the protection of staff and so forth. And so we've had a good trial run of that. We found out that we can do it. We've got everybody trained, and they know what to expect. And we can handle up to the limits that we saw back in early April, and we can go higher, we think. So we feel well prepared to do that and resume more normalized healthcare operations so that people can feel confident that they'll be able to safely get their care for their heart disease and their diabetes and their lung disease, have the surgeries that they need for hip replacement, knee replacement, and so forth. And the way I characterize it, we've essentially figured out that we can create 2 systems of care, basically 2 hospitals within the hospital, so that those who have COVID or possibly COVID can go through a system that's safe for them and protects the healthcare workers and the rest of the community. But we also have a system that's separate, that people can safely obtain the healthcare that they need. And in effect, we've created a huge clean zone where it's safer to be in that area than it is to be at the grocery store. So that's kind of my standard, my grocery store standard or my grocery store measure is something that I need to do from a healthcare standpoint. Am I safer being there or am I safer being at the grocery store? Most people feel pretty comfortable going to the grocery store, So you can be very, because we do it,
Yeah.
we take precautions. Those of us who are intelligent about it are taking precautions when we go, but we don't avoid going because we need to. That's the same thing with healthcare. We need to get those services. We've created the space and the processes to ensure safety in getting those. And so we can actually feel more comfortable about our safety in those clean zones than we can pretty much anywhere else in the community, with possibly the exception of our own homes.
We're going to get to your questions in just a minute, but we're going to turn back to Christine real quick one more time and just go, since you hit the ground here earlier this year, you've had a lot going on. You've come in from outside the community, taken over the health department, moved the location of the health department.
Yes.
Talk a little bit about how the health department is set up. I know you all had a mask giveaway last week. How did that go? And are you back up and operating for the public the way you want to be right now?
I don't think anybody's up and operating the way that we want to be up and
As best
operating.
as you can be.
But yes, the health department did move. So physically, we've moved into our new facility, and that's at 100 South 5th Street, right there at the corner of A Street and 5th. So we look right out at the Annex building and Fire Station 1, two great partners for us to have. We did do the mask giveaway last Saturday. It served a few purposes for us. One, to get all of the masks out to the community. My main goal last Saturday was to have masks be on everyone's topic to talk about. When to wear them, how to wear them, what kind do I need to wear, not should I wear them. Everyone, when you're into a public space, should be wearing masks. That's really shouldn't be a question of do I wear it. It should be which one do I wear, which one looks better with this shirt. So when you're at the grocery store, you need to have a mask on. Nothing beats proper hand hygiene after you leave the grocery store too. But so we have moved. When we gave away those masks, that was a good trial run for some kind of mask clinic. So we were thinking ahead of when a vaccine does come available, how will traffic flows go if we decide that doing a drive-through clinic would be one, and we realized it could happen there. The traffic flow was good. We worked with the Richmond Police Department. We had the sheriffs there. The fire station was on call, that if we needed their help with anything, that they'd be more than happy to help out. We were able to give out about close to 1,400 masks over the time period last weekend. And then we had some masks left over from that, so we called Child Protective Services, got them some masks because we had a lot of children's masks that were donated to us. The Boys and Girls Club, and then some other businesses called and said, hey, could we get some masks? And so we were giving those to them. People have asked, are we going to do another one? If we ever have a buildup of a lot of masks, we certainly will do all that we can to get them out to the community. So another mask giveaway would be something we would do.
Okay. Dr. Thomas Huth, Reed Health, Christine Stinson, Wayne County Health Department, they're here to answer your questions. I'll shut up now except for reading a couple of these. And we're going to start with some questions that we didn't maybe get to last week, so some of these may be a little bit dated, but we do want to try to get answers. Since there was an increase in the number of positive cases recently and 2 additional deaths in Wayne County, is Wayne County going to implement any additional restrictions or guidelines for businesses who are reopening for the public? Christine, I'm going to turn to you.
Yeah, I can talk about that. I don't believe so. I think that Dr. Huth and I and Dr. Jetmore and several other counties and some other players, Dr. Ryder, who's the president of the Board of Health, all talk twice a week on morning conference calls. And we're looking at indicators from Reed Health and our healthcare systems. Are they getting overloaded? Are they able to handle this? So not just the positive cases are what we look at of reacting and putting in regulations. We're really looking at what can our healthcare handle on that. So we've looked at Reed Health. They seem to be doing good. They're able to handle the cases. Why we got that bump in cases, a lot of people said, well, you're doing more testing. You're, of course, going to see more cases, and that's true. That is true. So we're not looking at just the case count of positive cases of how we set forth regulations. So we'll be watching our healthcare systems very, very closely when we are recommending further restrictions and things like that.
Next one. How will the antibody test allow us to open up more? Is this a test we will see soon in our area since we have limited testing now? Dr. Huth, I'll let you start with us.
Well, the antibody testing is kind of a bigger subject, and I think there are several things to keep in mind. Certainly, an antibody test can, as long as it's accurate enough, can tell you whether somebody has been exposed to the virus in the past. Unfortunately, what we don't know very much about right now is whether that means they're immune. We hope so. I certainly hope that's the case. That would normally be the case. But on the other hand, there are beginning to be some cases we've noted around the country where people have had the infection in the past and then seem to get sick again. So the question is, for instance, even if I have antibodies to an early form of the virus. Maybe it's mutated to the point where it's essentially a new virus from my body's standpoint and I can actually become infected again. Those are the kinds of things that the scientific community is working out now. But with a little bit of luck, what we'll find is that having the antibodies in the system will mean that we're immune, and that will have implications for how much immunity is in the community and can maybe inform the decisions about how quickly to step up reopening efforts. But I think we're not there from a scientific standpoint. Now, to the question of is antibody testing available, there are antibody tests that have received emergency use authorization from the Food and Drug Administration. Unfortunately, they're not widely available. They're really, like all other forms of testing, they're being tracked to the hotspots of the country, and within it, and those that are allotted to Indiana are being tracked to, Marion County, Lake County, Cass County, and some others. So we don't have that readily available to us right now in the in Wayne County area and surrounding counties, but I think that will change over time. I do know that the special research project that the State Department of Health has been doing with IUPUI and some other organizations to try to do some epidemiologic surveillance of how much evidence there is of infection experience in the general Indiana community did include antibody testing, but that's not something I can order today and get on somebody. So that's a stay tuned factor. We hope that the antibody testing will be very helpful in defining who's at risk and who's not, but we're not at that point of being able to say right now. So I don't want anybody to go away pinning a lot of hopes on, gosh, if I can find some place to get an antibody test, then I'll know whether I'm immune. I can't say that with any certainty right now. So I would not encourage anybody to believe that.
I will say, part of that question said that we're under testing, and Wednesday, Wayne County was lucky enough to get one of the first 20 Optum ISDH testing sites. So anyone that has symptoms or has been a close contact of someone that has tested positive or been clinically diagnosed with COVID-19 can go to the Armory, go to their website, register, and then I did it this morning. I went on about 11:15 and was in and out of the Armory by 11:15. So
and I think that test is the nasal swab
It
test.
is.
That's not the antibody test.
It is
just so
not the antibody test,
So
yeah.
we're clear on that.
Right.
It's the test that we are normally doing, have been doing, and but we would like to see that test done more frequently
Yes.
too. Actually, I mean, I think if we had enough testing that we could get the whole county tested, I would say, just go get tested. Even though you can have conversations about, should we, maybe you should be having symptoms or something. But we do know that there's increasing awareness, let's put it this way, that there are probably a sizable number, a significant number of people who carry the virus but don't have any or have minimal symptoms. And so, I can't really, with 100% certainty, tell you that I'm not carrying the virus right now and shedding it.
Wow, just made me feel comfortable. Thanks.
Yeah, that's why we're 6 feet apart, and that's why I have my mask right here.
Yeah.
One of my masks right here in my pocket. So when I'm in a public place, I wear a mask because I can't guarantee that I won't be a problem for somebody else. And so the fact of the matter is that anybody in the community can go on the website for the Armory test and go get an Armory test today.
Yes.
And virtually anybody can. It's a low bar to getting
low.
Authorized for it.
It's a very low bar. I didn't fabricate any symptom. I have a little bit of a headache today. I'm prone to headaches, but they just asked me some of my symptoms. One of the questions was, have you been in contact with someone that was COVID positive? And I put, I don't know, because I don't know. I go to the grocery store. I know that in our case contact investigations, we know we're telling people to stay home, to isolate, and they're telling us, I'm not going to do that. And so we know they're going out in public. So anyone that's been to a grocery store or any public space could reasonably assume they've came into contact with someone that is shedding the virus. So if you're having any mild symptoms or you've been a contact of someone with COVID-19, I encourage everyone to go on that website, get registered. There's also a phone number that you can. I can give those out if you guys
Yeah,
want
great.
those. Let me get that in my stack of goodies here of all the information. So it's the ISDH testing site. We have this on the county website, but the website is lhi.care/COVID testing. So hopefully you guys can get that up there for them to do that. And then the phone number is 888-634-1116.
LHI.care backslash. Okay. Forward slash. COVID testing.
COVID testing. I'll give that to you, Eric.
Okay.
You can have that.
Thank you.
Yeah. So, the more that we test, the more that we're able to get a good look at what's out there in the community, the better we're going to be able to make good informed decision on policies and opening things back up or keeping things closed or pulling back regulations. But right now, where we're at, Wayne County did go a little bit stronger on their guidelines with that joint order with the mayor and the commissioners. Any public employee, so anyone that's working with the public, whether you're a cashier or you're a gas station clerk, a hairdresser, those employees have to wear masks. And we encourage the public to do the same. When possible, we understand that when you go to the dentist office, the patient is not going to be able to have a mask on. We understand there are limitations to having people wearing masks. So when possible, when you're in public, you should be wearing a mask. And that's, I wear the mask to keep you safe, Eric. I appreciate it when you wear a mask to keep me safe.
Okay.
And let me add this too, that the importance of testing from a case-finding standpoint. I don't want to imply that I want there to be more cases. I don't want more cases, but I want to find as many of the ones that we have. And that's important from a kind of an epidemiologic standpoint because that gives us the right denominator when calculating such things as the case fatality rate. Right now, in the U.S., the case fatality rate is close to 5.9%, which is very high in my view. The best you can find in the world is Taiwan, the little Chinese island of Taiwan. It is a separate country from China, from mainland China, but they have the lowest case fatality rate in the world of 1.37%. And I think that number is probably closer to the true case fatality rate. The problem in the U.S., including Indiana, is that we've had such limitation of testing capability that we only have been testing those who are most likely, who are more sick. But we know that there are lots of people out there who actually have the disease. We just can't case find them from testing because we don't have the tests. So, the Armory testing is a great opportunity for anybody who's got any degree of symptoms at all. Go get the test if they haven't been able to get it through our respiratory clinic or other ways. And go get the test because we want to find those cases and get them identified. It's partly a health department responsibility to do the contact tracing and stuff like that. But I am interested in seeing, trying to get to what is the real true case fatality rate. And I think it's the 1.3% range, which sounds low, but that's actually 10 times the influenza death rate. But I think that's probably where the true number should settle out. But we've got to find the cases to be able to calculate that.
Yeah, and it's important. For the past 7 weeks, probably the number one call that we're getting at the health department is, where can I get tested? Where can I get tested? Why aren't you guys testing? I can't get a test. I'm I got a cough, I can't get rid of this cough, where can I get tested? And we've been limited. We refer them to the respiratory clinic, and they would do an evaluation and see if they met the threshold of testing. Well, now we've got this ISDH Optum testing site here in Wayne County, and we were lucky to be one of the first 20 counties to get this. And when I went to the Armory today, they were like, we are getting no one. So if we don't utilize this testing site, ISDH will pull it to a site that does utilize it, and because they'll feel like we're not seeing cases, no one is wanting or needing testing because it's free. This is free testing. If you have insurance, they'll take your insurance, they'll bill your insurance. You do not need a doctor order to get the testing, but you'll get no test or no bill at all. They'll just take whatever your insurance will cover of that. If you have no insurance, it's free. There's no bill to anyone. So there really is no hurdle for someone to get testing now. It's very, very easy to navigate through their website. It was simple. Like I said, I got on there about 11:15. The health department's at A and 5th Street. The Armory's at 1200 West Main Street. So as long as it took me to leave the health department, drive down there, I was out of the testing site by 11:15. So less than 25 minutes from the time that I logged on to the time that I was walking out from being tested. And it is that nasopharyngeal testing that goes in your nostril. They do both nostrils. It wasn't something that I would like to do every morning, but it was a test. I survived it. It was fine. But I encourage everyone, there's really no reason, if you're having symptoms, if you feel like you've been in contact with someone that is COVID positive, to go out there and just get your status right now.
Right.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are still taking your questions. Before we go back to your questions real quickly, with the advent of the testing site at the Armory, is the respiratory clinic going to continue, and is there a thought as to how long that will continue in place?
The respiratory clinic will continue, and we also have one in Connersville. It's a lower volume, smaller operation. But both will continue for the foreseeable future. We have no plans to end them. They'll continue as long as they're needed, and their real value for Reed is that it helps us to keep sick patients out of the areas we want to make sure are clean from the COVID standpoint, like doctors' offices and so forth, and the urgent cares. But and then from the patient standpoint, it's a very systematic way to go through quickly and get evaluated for your risk. And really, the point is is not so much to get tested; it's to get evaluated for your risk of having a poor outcome. So that we can implement systems to help case monitor people, so that if they begin to have problems, we're right on it. And we have had a number of people that have been referred directly to the emergency room because they've been very sick, and they had a number of admissions to hospital from that and so forth. But we've also, we might have mentioned this once or twice before, we've had people come through the respiratory clinic that had things like ruptured appendix and having a stroke and heart attack and that kind of thing. So, it's a whole different story about how that happens, but it has enabled the rapid identification of people with other problems. Bottom line is, we're going to continue it for the time being until or unless we develop equivalent and safe processes in doctors' offices.
And we don't want people to use the testing site in lieu of going to Reed Health, the respiratory clinic, because they'll be evaluated. So if you're having severe symptoms, you're probably better to go there, where you'll be seen by a doctor. You will not be seen by a doctor at the Optum testing site. So the Optum testing site really is for the people that are having the very mild symptoms, and 80% of people, if you have COVID-19, will have mild symptoms. You'll be able to convalesce at home. You'll recover nicely from this. Those are the people that should be going. People that are having more severe symptoms, dangerous symptoms, or have underlying health issues, they should be going to the Reed
I think that's a really good
Clinic.
point, Christine. If you're sick, you need to be
Yes.
evaluated for being sick.
Yes.
Your first thought should not be, I want to get a COVID test.
Exactly, yes.
That would actually delay you getting the care that you need.
Yes. Yes.
So, we have to exercise some judgment in this, good judgment.
It's funny, I saw a video of a comedian that was doing a spoof of like a press conference, and was trying to talk about how they don't understand how we're not clear with what we're saying, and there was all these exceptions, and I feel like I'm doing that every time I talk. Everyone should go get tested. Now, if you're having symptoms, so there's always a caveat to everything that we say here. So I hope I'm as clear as mud to everyone.
Right.
I think you're doing fine. We'll go back and get some more questions. Next question up. How communicable? How communicable could the virus be in a public facility such as a campground shower house? Are there any precautionary measures that should be taken short of not using the shower facility to help minimize exposure? Yeah.
Well, maybe I'll start it off. You can think
Please.
about it. Obviously, public spaces are any public space. We have to kind of think of the specific situation and what are the risks associated with that, or what are the, when I go to a public space, I'm thinking particularly about how close do I have to get to other people, and what surfaces do I have to touch in that place. Those are probably the two main things on my mind. And so to use the campground shower example specifically, I would probably have no problem with going and using the campground shower, except I would maybe, the shower itself, I'm getting clean, I'm using soap, that's good from the standpoint of sanitization, but maybe I'm being careful about where I'm putting my stuff and what surfaces I'm going to have to touch in that process. So, and then maybe on my way in and on my way out, I'm also using hand sanitizer to wrap things up on each end of it. So I don't think I would worry too much, especially maybe the thing to do in that scenario is to maybe inquire, what are your sanitary practices for cleaning the shower? How often are you doing that? And that kind of thing.
Well, I'll go with Dr. Huth's answer on that. I would not be a fan of community showers in general, but that's outside of COVID-19. So I would go with Dr. Huth's answer on that.
Okay. They're watching the back and forth between Ryan and I. We have to have a way of communicating. Ryan talks in my ear, and I pass him notes. So if
Okay.
you see me hold something up, I'm just passing information back and forth. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live in this program. Thank you, John and his staff down at CTV3 in Connorsville for also airing this program. Let's go to the next question that we have up. What criteria is Wayne County using to determine whether we move forward to a new phase of the governor's reopening plan here locally, or whether we roll back to a previous phase?
And I think that we've talked about that. Case numbers will be one of the factors, but really we're going to be looking at our healthcare systems and how well they're doing with cases. If we start seeing that our healthcare systems are getting overloaded, we will probably recommend a rollback to, either if we're in phase 3, we may roll back to phase 2, but we're really going to be looking at how are our numbers at our healthcare systems. Do we see them getting overloaded? That's the main reason that we do this, is to not overload our healthcare systems.
I think corollary to that would be, and it's probably under the same umbrella really, would be, what happens with cases occurring in what the state is calling congregate settings, the jails, nursing homes, dormitory type arrangements, to the extent that any of those still, are being used these days. If in the process of reopening suddenly you have a spike in in lots of nursing home cases, or the jails get outbreaks within them. I would think that might be the kind of thing that either Christine's department and the county commissioners or the governor might take into account in determining whether we're really on the track that we need to be to be able to continue.
And I think that when the governor has allowed some larger gatherings to happen at churches, at weddings, not necessarily the reception, but the weddings. These are kind of trial runs of what's it look like when we're allowing some mass gatherings to happen. And if we see, early on in this, with us allowing 50 people to gather, you may see a rollback to, no, we're going to stay back at the 10, gatherings. But it would take, I think, a lot for us to roll back all the way to phase 1, which was, the travel restrictions and things like that. I think that we all are feeling comfortable with allowing a slow process of opening up. And at any time in the phase, if we see that we're starting to see a spike of cases, we probably will not move to the next phase of, phase 3. And I know that on the governor's roadmap, there's, the dates on those, but he talked about, if we see that phase 2 is not going well, we're not going to move on to phase 3.
And that's the same way 3 counties were not even put
Right.
into phase 2 at the very beginning
Right.
of this. Next question. Is it a correct understanding that currently there are sick people with COVID-19 and still working? Should we with either an older person living in our household or other risk factors be concerned, or how do we protect ourselves? Conversation basically coming up, people going back to
Yeah.
work. Sometimes, whether they want to or not, they're being called back to work. So what are the precautions? I think we're going through that again. As they go back out and they begin
All right.
working with other people, how do they protect themselves when they go back home?
Well, I think the wearing the mask is one of the big things that we're recommending. Employers should be enforcing the social distancing. One of the things that the health department we always are very cognizant of the 6-foot separation, to the point now that kind of when someone comes up on you, and just normal pre-COVID-19 would have been fine. I watch employees kind of recoil from each other, even in meetings and stuff like that, or just there in the office. When we open to the public, we will require the public to wear masks, and the employees that are dealing with the public will have masks on. But a lot of businesses and things are putting partitions in between employees when they can't get that 6 foot. Proper hand hygiene you should do. I'm very, cautious because I have a son that lives with me that's immunocompromised due to one of his illnesses. So I'm very, very cautious about when I go home, what kind of contact do I have with him. And so if you are living with someone that has underlying health conditions, or you have an elderly parent that lives with you, handling them with a lot of care and monitoring your own health. That's one of the things that we ask our employees to do every day, is to do a self-assessment every morning. How do I feel today? Do I have a sore throat? We log everyone's temperature at the health department every morning, but they're to ask themselves, how do I feel today? Do I have a headache? Do I have a sore throat? Is this normal, or is this something that I should investigate further?
And I think if somebody's actively sick with something, upper respiratory symptoms, even if they don't seem to be that sick, I think we would prefer that they not be at work.
Right.
So there's actively sick with something, and then there's what do you do about the situation that I referred to earlier, which is that we know that some people can feel perfectly fine but still be shedding virus. And that seems to be something that's very prominent with this condition compared to flu. One of the many ways this is a very different thing from influenza. And that's where the things you talked about come into play. We still have to do the distancing, mask wearing, barriers. Businesses have to look at their unique circumstances and figure out how to navigate these issues, using common sense and reason.
Yeah, the health department, the government can't go into every single
Right.
establishment and set those policies in place for them. So we're giving you the guidelines to look at what are your processes. How can you make that safe for your employees and the public that's coming into your business? And if they want to call the health department, we take those calls every day from businesses, saying, I want to be safe. I want to keep my employees safe. What can I do? We're happy to come out there. We'll look at your process. We'll give you some guidelines. But there is a certain amount of risk. There is a certain amount of risk by reopening everything up. We can't keep everyone safe. We've shifted. Dr. Jetmore, talked about this, that we've made a shift from the government trying to protect the public to now the government's giving the public the information that they need to make good, sound decisions and put, policies and practices for themselves into place to protect themselves. But there is risk. There is risk because we do know, like Dr. Huth said, there are asymptomatic people. We know through our case investigation, sorry I keep hitting that. We know through our case investigation that we'll talk to people that have a positive COVID test and they say, but I feel fine. And my employer is telling me I have to come back to work. I can't lose my job. I've got 3 kids and, a wife. I'm going to go back to work. We plead with them, to follow the guidelines. But I understand. I get it. They're looking at, I got to feed my children, and they got to get back to work. Their employers are pressing them to be back to work, and so wearing the mask, proper hand hygiene, and the social distancing. Those are the good keys that we can give to people.
Now, there's another situation that was kind of involved in that question, and that is how do you protect the people who are at risk as we open things back up? And I think of it kind of like there are people who, like, for maybe an indefinite period of time, are going to have to be treated like in a reverse isolation sense. And that's not a new idea. There are people who have, say, immune-compromising conditions that even under normal circumstances, they have to limit their exposure to people in the general public because of their own personal risk. And that's the approach we're going to have to take for a good while with certain subgroups like the elderly in nursing homes. And that's why on the governor's plan, they don't actually have a date at which they go back to normal operations. If you look at the plan, what it says is for the first couple or 3 stages, they are closed, period. They go operate exactly like they are today with restrictions on visitation and access to the buildings and the things that those nursing home residents can go out to do. And then it says for the later stages, it will be reassessed, but they don't actually have a reopening date. And I think that you can extend that reasoning to, say, elderly folks or people with chronic medical conditions who are managed in their homes. With their caregivers have to erect reverse isolation procedures around them and be careful about who's coming in and for what reason and for people who have to come in, what they're going to do when they're in that environment with those people. They're going to wear masks, they're going to sanitize, they're going to maintain distance where possible. So we have to apply common sense to those situations, and that responsibility falls onto the people who are responsible for those environments. And I can't go out and tell people, here's what you have to do. Christine can't go out to every situation and tell them, here's what you have to do. But we're all smart people and can figure this out, understanding some basic principles.
And the first one is understanding that people have their space and give them their space. And we haven't always done that. That's not part of our normal way of operating.
Right.
We've got about 15 minutes left. We've probably got about 6 or 7 questions, so we'll go pick up a couple more.
Rapid fire, come on now.
Is Reed testing patients prior to outpatient surgeries to protect everyone? Is it necessary? Is this necessary as it is being done at other hospitals?
As quick as possible, say, many hospitals around the country are moving to more testing for prior to outpatient surgeries. We are doing that some. We have defined categories of risk, and those who are at the higher risk, either because of the patient situation or the type of surgery they're having, they are getting tested routinely. And as we get more testing available, we'll probably more widely do that. I can foresee that we'll be at a place where any outpatient procedure will be preceded by a test, just to make sure that it's safe for the caregivers particularly, so that we're not accidentally bringing virus into the premises. But even today, where we're testing some, we're treating everybody. We're erecting a system so that if anybody comes in with virus, we are protecting everybody involved.
Okay. And we do want still full answers. We'll do the same thing next week, and we'll start with any questions that we don't get to. So let's make sure we give full answers out. Next question. Are the news stories about children who are developing multi-system illness post-COVID-19 truly related? As schools are now starting to meet to figure out school for August 7th, less than 3 months away, do we really need to be looking at, say, 6-foot distancing, masks? What other factors should schools be considering? No public schools are looking at plans now.
I can answer the first part real simply. One of the many ways COVID is different than influenza is we're learning now about complications that may occur in adults. But for the last few weeks, we've been talking about a hypercoagulable state that occurs that people have, and that's part of the thing with the COVID toe that people know about. And now, in the last couple of days, there's talk about children having particular complications. And so this seems to be a real thing. But exactly how it all works, I think we're too early of a stage to be able to say a lot definitively. But the rest of that question is really kind of more of a public health question about the schools.
Them saying that no schools are making plans. Schools are planning. Schools are talking. Schools call me all of the time and want direction, and we give them the direction we feel comfortable giving them, but they're in conversations with ISDH at the superintendent level with ISDH. So how school will look when school starts back up, wow. Kind of a wait and see. I'm excited to see what it's going to look like. But
a little early to tell.
Yeah, I've heard of kind of splitting the classrooms to where there'll be, this group will attend school on these days and do e-learning this day, and then they flip-flop. And this group is in the school on these days and do e-learning on these days. So I think that there'll be some innovative ways of doing school when we open back up in the fall. But I think that there'll be some sort of schools when schools open. How it will be is anybody's guess. I think lunchrooms will look real different. I think back to, I'll show my age, back in the 70s, there was an energy crisis. I don't know if anyone remembers that. I'm probably the only one.
Not hardly.
But the cafeterias were closed, and so there were different areas set up. Every other light was turned on at the school, and so schools get really innovative to be able to still teach in some adverse times. And I think that you'll see some things that are done differently in the fall. But I think kids will be somehow back in the schools. Maybe not every day.
One thing that I've heard is maybe morning students and afternoon students.
Could be.
And that's not an oddity. When I actually started high school, there were so many kids between two high school buildings. That's how we worked. Freshman, sophomore year, there were morning classes, and then afternoon classes. All the athletes got the morning classes so they could practice in the afternoons.
Yeah.
I think that's what drove me to go into track.
Yeah, I think that you'll see some different models out there. Some will maybe even carry on after this because they'll become such a good way of doing things. I think that e-learning is evolving, and I think that you'll see quite a bit of that.
I think we have a follow-up to that last question for Dr. Huth. Can Reed care for a child with COVID?
A qualified yes. I mean, I think we've not actually had any children admitted with COVID that I know of. that if they don't have complications, we can I'm sure we can manage that there, because it's really just a matter of supportive care, and we do that all the time for kids with a variety of other illnesses. But if they get into one of these complicated states like we've been hearing about the last few days, the likelihood is we would transfer that to, you know, one of the children's hospitals.
Okay. And next question up. Why can't masks be set for 24? Okay, let me start that again. Why can't masks that set for 24 hours be used again instead of being thrown away?
I think we're talking there about the extended and reuse of PPE in a healthcare setting, and we do that to a certain extent when we do have some standards and some processes for extending the use of things like the N95 masks and even the standard surgical mask. And reusing them where that's appropriate under certain circumstances. A little bit detailed to get into here, but we do that some now. So we don't necessarily throw them all away. But I would tell you that the standard surgical masks, they're so lightweight and so thin and stuff that it doesn't take much use for them to kind of, you know, be better to get rid of it and get a new one.
What is the process to determine what business can and can't open? Specifically, why can gyms open on the 24th, but not a sports training workout facility? But a sports training workout facility cannot. So.
Well, I'll just let me speculate, and you can think about it a minute. With sports training, especially the contact sports, we're talking about a different type of physical activity where people are in much more close contact. You know, when my gym opens, I'm going to go. But I'm going to be vigilant and ask them questions about what are they doing about sanitizing the equipment, what are they doing about sanitizing the locker room and the showers and stuff like that. And but that's just me going in there. I'm doing that kind of, I'm a little solitary unit moving through there. But when you're talking about a team sports thing where you've got kids that have to be in close contact and like that, that's a different animal. So I think that probably is why there's a difference.
That's why there's a different. Another many calls that we've got is about baseball and why baseball is not allowed until June 14th, and that's for practicing or anything. It's because it's very hard to maintain the social distancing and still play baseball. And baseball is probably one of the least contact sports that you have. But there's a lot of licking of fingers and different things that you do when you play baseball, and sharing of bats and things like that. So, and it's also a sport and that can be postponed. You know, we don't have to play baseball at a certain scheduled time. We can push everything back and reevaluate calendars to do things. And it's one of those things that the governor felt like could be pushed back into June 14th. And that's one of those things that is going to be evaluated June 14th. It doesn't mean that we're going to run out their full force. We're going to see how these first, phase 2 and 3 goes, or stage 2 and 3 goes before, we go into stage 4, and we may push stage 4 back. But I think that pushing back some team sports and those gathering sports is something that is a good thing that the governor did.
Okay. Another question up. Save the best for last. Testing was extremely limited when local officials decided to implement restrictions in Wayne County. Now many of those restrictions are being lifted at a time when testing is ramping up. With more testing being done, more positive cases are expected. Couldn't this potentially skew the data and make it look like the spread is worsening? Could this cause us to revert to a previous stage of the reopening plan without merit?
And I think that we've talked about that. The testing numbers is not going to be the only driver of this. So, Wayne County's tests could go through the roof, and I could report on Monday we now have 500 new positive cases. That's not going to change our restrictions. We're still going to look to our healthcare systems and see, are we seeing an increase in cases going to the hospital? We get a run sheet from our services, through the EMA, they let us know how many runs the fire department has had to go on and everything like that. Are those runs going up? Are we seeing more people in critical need of health care? Those are the factors, along with that we're going to look at before we would start to either roll back restrictions or not allow us to move on to the next thing. So those numbers are a factor in there, but really we're going to be looking at a lot of different things, and how our healthcare facilities are able to handle that is going to be one of the things that we look at very closely.
Okay. Talk a little bit about how to wear a mask. And I know that the health department had a piece that was put together. So for those people, we're not used to doing it. We've got about a minute and a half or so. Can you talk about how that's supposed to look?
Sure. So I have a homemade mask here, and I'll put a shout out to my sister. She's an excellent, she was in 4-H back when she was like 8 years old, and she learned how to sew. I didn't, I showed cows. So she has started making masks for everyone in the family, and she gets wonderful fabric, but it's homemade. It's got 2 little loops here. It's not the one that goes over the ears. So what I do is I put it over my face like this, and then I put it like this to where this is at the top, kind of at the crown of my head, and then I position it to where the mask comes down over my chin and over my nose. So what I don't like to see is when I go into a store and I see someone wearing their mask like this, it's really not doing anyone good around your neck. Or I see people wearing them like this because they do tend to fog up your glasses, so they'll pull it down like this. It's not really doing a whole lot of good there, so over your nose and over your mouth. And if I did it wrong, Dr. Huth, please point out how I did it wrong.
Doing fine.
But this is how I wear my mask, and anytime you see me out in public, this is what I'll look like.
I think that the key is to cover the nose and the mouth, but in addition to that, it should come under the chin if possible. And there should be minimum gapping, and none at all if you can manage it, on the bottom, the sides, around the top, over the nose, and so forth. As little gapping as can possibly be done. I sometimes will see people they'll have it over the nose and the mouth, but it's however it's set up that they've got these huge gaps, and big holes in the sides. Well, you're reducing the effectiveness of the mask in that case. So it's the seal around as much as possible.
And it does, important. When you're wearing a mask, it will make you more tired if you wear it a lot. It does labor your breathing. It's harder to get air in, and so it's harder to talk. And so when I've had to wear these in some public meetings, and like right now, you have to take pauses to get the air to come in, and so you will kind of sound a little different when you're wearing a mask. But I think a homemade mask is perfectly fine for what we're looking for.
All right. Christine Stinson, Wayne County Health Department, Dr. Thomas Huth, Reed Health, thank you both very much for being here.
Our
we'll
pleasure.
Be back again next Friday afternoon at 2 o'clock for another Ask the Doctors. I wish you well. Have a good weekend.